that I will be demonstrating is the skin closure of a surgical incision using the vertical mattress technique. The technique of suturing is thousands of years old and is used in every surgical procedure that requires an incision. The goal of wound closure is to eliminate dead space, to support and strengthen the wound edges until healing has occurred, to approximate the skin edges for aesthetically pleasing results, and to minimize the risk of bleeding and infection. The main indications for use of vertical mattress sutures is to invert the skin edges. The choice of suture technique depends on the type of anatomic location of the wound, the thickness of the skin, the degree of tension, and the desired cosmetic result. To begin the demonstration of my skill, I have selected the appropriate suture material and instruments. I will load the needle holder by clamping approximately 1/3 of the distance from the swagged end of the needle to the needle point. Next, I will pull the skin edge on one side of the wound with the forceps, then use my needle holder to push the needle through the skin on the other side of the wound and grasp the needle, pulling the excessive suture through the incision. I will reload the needle holder with the needle point reversed, then insert the needle on the same side of the exit, but further from the wound, while pushing the needle to the other side of the wound by taking a deeper bit of tissue. By incorporating a large amount of tissue within the passage of the suture loops, the technique permits greater closure strength and better distribution of wound tension. The vertical mattress suture is commonly used in the body sites where the wound edges tend to invert, such as the posterior neck or wounds that occur on the concave surface. I will now wrap the end of the suture around the end of the needle holder 3 times. Using the needle holder, I will then grab the end of the suture that is sticking out on the first side of the alternate, wrapping the suture using a backhand, forehand method for 3 additional times. Next, I will pull the suture snug, perpendicular to the wound. Using my suture scissors, I will cut the suture, leaving an 1/8 of a tail. I will continue placing suture along the length of the wound until the entire incision has been closed. This concludes my demonstration of skin closure of a surgical incision using a vertical mattress technique.